We're here. We have a cat carcass or cat cadaver, and we're actually trying to distinguish the cat veins. We're going to start off with the brachial or the thoraco-cervical area. As you can see there, we have the heart, and above the heart, you're looking at the superior vena cava. And then that is the
internal mammary.
Right. And then
Sounds like I'm drunk already.
you've got the vertebral, what is it?
Vein.
The vertebral vein. And then superior to that, you've got the brachiocephalic vein. And then median to that, you're looking at the subclavian, right? Subclavian vein, which turns into the, what are we looking at? The axillary? Is that the axillary? Yeah, the axillary vein. And that would be our left axillary vein, which turns into, or it goes and turns into, goes deep into the, what is it, the brachial vein, then turns into the cephalic vein that we can't really see it because the dye didn't really take to it. So, but it runs along the looks like the biceps, and then comes back in around over, and comes back. So it's probably along there. Kind of looks a little bluish there, but we're not quite sure. Dr. Sternberg wasn't able to tell well, we didn't really go into it. So then we come back up, and then we have the what is it? The
What about this one?
oh, what did we say that was? The thora.
Is this a sub?
Subscapular vein, and then the cervical, or what did we say it was? Who's got the picture?
This
That one was
the transverse scapular vein.
Transverse scapular vein, which runs or branches out from the external jugular vein that runs along the cat,
The right one.
and that would be our right.
No, it's our left. Oh, left.
Left external jugular vein. And then that would be our transverse jugular vein. And then I think that's all we can see here as far as the thoraco-cervical cap veins. Then we're going to try to move along down into the renal area of the cat, and I'm going to hold that real quick. Speak for a moment, please. We're looking at the inferior vena cava that runs along the majority or the major part of the vertebral column. And as you can see, you have the right kidney there that protruding from there, you have the renal veins that are two. Can you see that? Move the lamp. There's two veins that are coming out from the kidney, and see them branching out, and then from there, the vein that is lateral would be the right. Yeah, is it the right or left? Yeah, it's the right.
Genital?
Yeah, the adrenal.
Oh, the adrenal one is over here.
Oh, is on the other side? Yeah. That would be the adrenal lumbar vein. that's posterior to the kidney. And then you have this
The
one is,
genital?
I believe this is
This
the
one?
genital. We believe that might be the genital vein. And then from there, you go down and
me
you
go on this.
run into the,
This one right here.
yeah, which is the iliolumbar vein. And in that matter, that would be the left iliolumbar vein. Then from there, you would branch out and form a Y, which at that point would be the common iliac vein. As you can see there, it Y's there, branches out, and which in turn turns into the
This is gonna be hard.
external iliac vein.
This
Which
is
is-
external right here.
External iliac vein there. And then that Y's off into the femoral vein.
Wait, you forgot the internal.
Oh, okay, we forgot the internal. Oh, that's right. There's the external iliac vein and the internal iliac vein. And then
Then right here.
from the external iliac vein, there is a Y that goes into the femoral vein, that turns into the femoral vein, branches out, and goes, and the other part, the deep part, goes and turns into the deep femoral vein.
I don't even know where that is.
Which I think, if I'm not
Maybe this one?
mistaken, it's right here. Yeah, that's the deep femoral vein.
So this is
The femoral, and then that's the deep femoral.
deep femoral.
Yeah,
And then femoral.
and then the femoral, and then the femoral turns into the saphenous.
So it'd be somewhere over here.
Yep, and I believe that
The
might,
saphenous is not even on there.
no, but we know that this is the
Okay.
saphenous from here, and then from there it turns into the other ones. Okay, that's it.